Assalamu alaikum. Today we are going to learn about how hypothalamus controls pituitary hormone secretion. So before going to discuss this topic, at first we should know about the hormone secretion from hypothalamus, the hormone secretion from pituitary glands, and what is hypothalamo-hypophyseal portal system and what is hypothalamo-hypophyseal tract. And finally, then we will learn how hypothalamus controls this pituitary hormone secretion. Now, firstly, we will learn about hormones of hypothalamus. We know hypothalamus has some releasing hormones as well as inhibitory hormones and some nucleus. This supraoptic and paraventricular nucleus responsible for synthesis of ADH or vasopressin as well as oxytocin hormone synthesis. So, let us assume this is our hypothalamus. Here are some nucleus like supraoptic, and paraventricular nucleus. Okay? And another side, some hormones like growth hormone, releasing hormone, growth hormone, inhibitory hormone, thyrotropin, releasing hormone, corticotropin, releasing hormone, gonadotropin, releasing hormone, and prolactin, inhibitory hormone or factor. All these are the hypothalamic hormones. Look at this area. Among all these 5 hormones, look at growth hormone releasing hormone, growth hormone inhibitory hormone, thyrotropin releasing hormone, corticotropin releasing hormone, gonadotropin releasing hormone, prolactin inhibitory hormone or factor. Among all these 2 hormones, look at, is inhibitory in nature. Okay, one is growth hormone inhibitory hormone, another is prolactin inhibitory hormone or factor. These 2 hormones are inhibitory in nature. Another side of the hypothalamus, it consists of some nucleus. One is supraoptic nucleus, another is paraventricular nucleus. These 2 nucleus is responsible for synthesis of oxytocin and A, D, H or vasopressin hormone. So, these are the hypothalamic hormones. Now, overview, hypothalamus releases some releasing hormone as well as inhibitor hormones, and another portion, hypothalamus consists of some nucleus, among them supraoptic nucleus and paraventricular nucleus. They are responsible to synthesis of oxytocin hormone and ADH hormone. Now, our second options, hormones of pituitary gland. Okay. So, let us assume this is our pituitary gland. This is posterior pituitary. This is anterior pituitary. The anterior portion of the pituitary, that is our pituitary, anterior pituitary gland, consists of some cells. The cells are like somatotropes responsible for growth hormone synthesis. Let us assume this is our pituitary gland. This is our anterior pituitary portion having some cells. Among them, one cell is somatotropes responsible for growth hormone synthesis. Another cell is thyrotropes responsible for thyroid stimulating hormone synthesis. Some are corticotropes responsible for ACTH, that is adrenocorticotropic hormone synthesis. Gonadotropes responsible for LH or FSH hormone synthesis, that is luteinizing hormone and follicle stimulating hormone synthesis. Another cell type we will find like that, lactotrope cell responsible for prolactin hormone. Prolactin hormone. So, that is anterior pituitary has 5 types of cells. All these cells are responsible for synthesis different types of hormones, like somatotropes responsible for growth hormone, thyrotropes for thyroid stimulating hormone, corticotropes for adrenocorticotropic hormone synthesis, gonadotrope cells responsible for luteinizing and follicle stimulating hormone synthesis, and finally lactotrope cells are responsible for synthesis of prolactin hormone. Okay. On the other hand, that is the posterior pituitary, they store ADH or antidiuretic hormone as well as oxytocin hormone. They are the store site for these two hormones. Which one? Posterior pituitary. Posterior pituitary is the store site for these two hormones, ADH or vasopressin hormone, another is the oxytocin hormone. So, this two diagram shows hormones of hypothalamus and hormones of pituitary gland. Now, how this hypothalamus controls this pituitary hormone secretion? This is our main concern. From hypothalamus to anterior pituitary, okay? From hypothalamus to anterior pituitary, a vascular portal system or connection is available, okay? This portal system formed by superior hypophyseal arteries as well as hypophyseal portal veins. This capillary connect hypothalamus as well as anterior pituitary. So, this vascular connection is a portal system. Basically, it is a portal system. It connects hypothalamus to anterior pituitary. Now, when this growth hormone releasing hormone comes via this portal system into the anterior pituitary and acts on these somatotroph cells, then somatotroph cell releases growth hormone. Where? In our blood vessels, right? When hypothalamus releases growth hormone inhibitory hormone, this hormone acts on somatotroph cells and inhibit growth hormone secretion. Clear? Fine. On the other hand, when thyroid releasing hormone from hypothalamus comes via these portal vessels, act on thyrotroph cells, then thyrotroph cell releases thyroid stimulating hormone into our thyroid stimulating hormone into our blood. Clear? When corticotropin releasing hormone comes via these portal blood vessels, act on corticotroph cells, then the corticotroph cells from anterior pituitary, they releases adenocorticotropic hormone into blood. Do you get the point? Similarly, when gonadotropin acts on gonadotroph cells, then gonadotroph cells releases follicle stimulating hormone or luteinizing hormone into blood. And finally, when prolactin inhibitory factor releases and it comes via these portal blood vessels, after reaching the anterior pituitary, it acts on lactotroph cells, then lactotroph cell releases, inhibits prolactin